We're on. Lights, camera, action. Good. Well, hello, friends. I want to thank you very much for joining. I have a special guest with me again today. I think this might be your fourth time you and me talking on camera. This is really cool. My gentleman guest today is a friend of mine and somebody who's extremely knowledgeable in a lot of areas. But today we're going to talk particularly about more building on top of what we talked about before about COVID, new research, new knowledge. So I'd like to introduce my friend and my guest, Dr. Luigi Boccuto. Thank you, sir.
Thank you, Carl, for the introduction. Hello, everybody. It's a pleasure to be back. I always enjoy our conversations.
I do too, man. One of these days I've got to get down there and we'll hang out when we have time and things lighten up a little bit for travel.
Yeah.
So last time we talked about COVID, and this was fairly early on. I don't remember exactly when, maybe late March, early April. And you had told us, quite a few things. I was just wondering what's been going on since then, because now we're how many months into this pandemic, and the numbers of cases and deaths have gone up everywhere, it seems, for certain states or hot spots. What are you seeing?
Yeah, it's really interesting, that question, because it already tells us what is the perception of this pandemic. How many months are we into this? So perhaps if you ask, someone in the United States, they will answer probably 3-4 months, because the real perception, started late March or beginning of April.
Mm-hmm.
Really, let's not forget, this is COVID-19. So in fact, it all started at the end of past year. So we're already into this for an amount of time that is reaching, 9-10 months.
Yeah.
We are not certain about the very first cases when they all started. It was officially shared with the international community towards November. The first cases were confirmed later in December, but there is reason to believe that maybe undiagnosed or uncharacterized cases have already presented themselves earlier in the year in China, at least. So how long we've been into this? It's starting to be a long time.
Yeah.
And definitely has been quite enough time to involve pretty much every single country in the world. So this is remarkable, because the definition of pandemics, applies to conditions that are spreading in different areas, different geographic regions, definitely different countries. But the reach of COVID-19 is obviously unprecedented, considering how fast it touched every single country in the world, even pretty remote countries, even pretty remote areas. There are reports about the Easter Island. They had cases there too.
Wow.
For people who have never been there, I've never been there, for example. I mean, it takes hours to get there from mainland. So
right.
It's a pretty isolated area. And there are other isolated areas, in areas in the northern hemisphere and the southern hemispheres. Everywhere, COVID has arrived. So that really tells us the high rate of contagion that this type of virus implies. And that really tells us that we need a worldwide strategy, because this is a worldwide problem.
Mm-hmm.
And it's really difficult to engineer such a strategy and to coordinate the effort worldwide, because unfortunately, even if there has been a lot of effort in researching on COVID, trying to find treatments and developing vaccines, unfortunately, we don't have a medical counteraction or a medical response to COVID that is still applicable to every single case.
Right.
Strategies right now, the most efficient ones, they have been pretty much empirical. So there is a combination of treatment. You know, you want to balance the cardiorespiratory problems. You want to treat the risk for coagulation. You know, it's always a matter of facing one symptom at a time. But we don't have a COVID cure. We don't have a COVID vaccine. So we're not there yet. Hopefully, you know, we will reach that point, but it takes time.
It's hard to fathom the magnitude of this. And I think you're the person who was sharing with me, and I never thought about this, but in the pandemic that started in 1918, I seem to remember it took about 2 years for that to reach around the world, but we didn't have commercial airliners back then, right? And now we do. So
yeah,
there you go. I mean, it's a vast difference in how fast we can get around to different countries and spread the germs.
Yes. And really, that tells us also how intertwined we are. You know, there are some activities that really depend on a commercial, you know, an international commercial network. And we have noticed that in the beginning of this pandemic, when there were some sort of bans for you know, products coming from China or from the Eastern Asia, and that was affecting the economy in a lot of Western countries. And you know, same things later when some borders were closed. Really, that gave us the idea that we're all in this together, but also the economy has brought us to a globalized level where we can't really, you know, give up on some countries.
Yeah, the economic impacts just so huge. I don't know what those numbers are, but can't imagine. So when we look at the primary method of, let's say, transferring COVID, now I'll ask you a question, but I'll just say this is what I've heard. And it seems like it has to do with, is it particles as we speak, maybe cough, sneeze, breathe? Is that where we have to be the most careful? And it maybe that's the reason for wearing a mask. In case we're a carrier, we don't know it. How does that work?
It's still a learning process in terms of what type of tissues are more heavily affected by the COVID infection. One hint is to look for the AC2 receptors, which are the main targets of the coronavirus. And they're highly expressed in certain tissues like intestine, kidney, or brain. And they're, of course, expressed also in lungs and all the respiratory system. So we know that the viruses from the coronavirus family are mainly passed through exchange of these aerosol particles. So the particles that we pass through, you know, our breathing and sneezing and coughing. And that is why we try to prevent the main channel of contagion, which is, of course, you know, coughing or sneezing. Obviously, for what we know today, wearing masks is the most effective way to prevent transmission of COVID. The passage through other forms of, you know, entryways like
eyes,
the
right?
eye, the mucosa, you know, it is possible. It's just has not been proved as effective as the way through, you know, breathing and coughing. For example, there has been evidence showing that the COVID virus is present in the feces of individuals that have been affected. You know, even later than the swab test turns negative. So it is possible that the virus remains in the intestinal mucosa longer than in the respiratory mucosa. So, for example, it has been hypothesized that even, you know, passing gas or, you know, intestinal gas could be a way to pass that. Of course, what is the answer to that? Always the mask, because you protect yourself and the others, from
Right.
one way of.
Well, not to be ridiculous, but this is just a fact of life. And it's kind of sad. I never understood this ever anyways, but I can't tell you how many times be in the men's room somewhere, and somebody's in the stall.
Yeah.
It's a men's room. They're not using the urinal. They're in a stall. They come out. They don't even wash their hands. I mean, it just I never could understand that. But think about, as you say this, I'm thinking about that, and then touching things, and they touch the doorknob, the door handle. Is there a risk of somebody walks out, they touch the door, and then I touch it? Is it possible? And then I rub my eye or something.
It's difficult to answer no, because really the risk is based on the viral load.
Mm-hmm.
So how much vital viruses will be left on that surface. And we know that the passages through aerosol or through coughing is more direct.
Sure, that makes sense.
About the survival time of the virus on objects, on surfaces, there has been a lot of controversy. And it's really difficult to estimate the actual risk, because once again, you might have some virus on your hands and you might, leave it on some surfaces and some objects, but how much does it survive and how much vital viruses survive? So they survive long enough to be passed to another person that touches that. Once again, what is the answer to that? Prevention. I've seen, and it feels kind of mortifying that, I've seen tutorials about how to wash your hands. Especially adult population should be thoroughly educated about how to wash your hands.
Right.
And unfortunately, even if this is one of the most basic procedures to, protect your own hygiene and health and others' hygiene and health, apparently not everybody knew how to do it properly.
Right.
So once again, we're not facing some sanitary protocols that would require particular equipment or very complicated procedures. We're basically facing a situation where life depends on washing your hands and wearing a mask.
Right.
We're not saying put on armor or, going through a series of blood tests every day, every morning when you leave the house. It's not that complicated, but unfortunately, the compliance is still lower than expected.
Mm-hmm. Mm-hmm.
And that is, to me, one of the most negative aspects of this pandemic.
Yeah, it raises concerns for me, and I know a lot of people, and I appreciate you sharing that very much. And one of the thoughts I've had going like all along now is the university where I was working with people, rehabilitation and so forth in the gym. They closed in mid-March, like a lot of places did. So we just got the reopening email today, reopening protocol. Really been debating whether, and they know this, so I can say this, it's not a surprise, of whether I want to return. Although they're going to limit, it's a very big facility. It's very beautiful, brand new last year. But regardless of that, no offense to any 20-year-olds out there, but the compliance of cleanliness and hygiene were already diminished, more so in the undergrads. And of course, we have undergrads who are very compliant, but we also have grads who aren't, but the grads tend to be more compliant. So it's just, I don't know if there's a maturity thing. I don't know what it is, but I start to think about people coming in from all over different areas and what they might bring with them. And I'm typically not paranoid about anything, but this has me concerned as to what's the likelihood in a gym with hundreds, thousands going through it per day, even though they're allowing, reducing the maximum number at any time, is still going to be hundreds of people. I don't know what to do. I'm not asking for advice from you. It's just,
it's
It's a situation that I'm trying to figure out.
It's a serious concern because let me take one step back. The only effective measure against COVID has been proved worldwide so far has been the lockdown. There are epidemiologic studies that proved how complete lockdown was able to decrease the numbers, reduce the number of cases in ICU, reduces the number of deaths, reduces the number of people hospitalized, and even the cases that could be managed at home.
Sure.
Lockdown works, but it can't go on forever. So it is a measure that requires a great deal of sacrifice, both individually and as a community. And it has a very heavy toll to pay in terms of economics. The problem is that in many countries, the lockdown has been implemented efficiently, properly, and the numbers dropped. And now we are observing some sort of second waves, even if there is really not the second coronavirus, it's still the same one, but the numbers are kind of bouncing back up. But the problem is that they're more manageable. Let's consider this. When we talk about management, it's really what the health system can offer in terms of assistance, especially for the most severe cases, so the ICU cases. At the beginning, so in March, when this pandemic hit Western countries, starting with Italy and other European countries, and then spread over United States, one of the most critical aspects was the fact that the intensive care units were being saturated by the cases. So they couldn't manage not only the cases with severe COVID-19, but also other patients that had health issues that require intensive care unit. So when we talk about management, we talk about managing the cases that will be more fragile and will require more assistance. That now is more doable after the lockdown because the numbers dropped and the hospitals are not overloaded. Mm-hmm. So hopefully the numbers will not go up again to the levels they were before the lockdown, but there is more confidence in managing this condition, just like other infections, other sort of critical conditions.
Sure.
Other countries, unfortunately, like United States, the lockdown was not as efficient. So the numbers didn't drop down that much. We're now observing a constant increase of cases. And luckily, we don't observe a proportionate increase in ICU cases or in death, because the environment is different. We're now through, especially in the Northern Hemisphere, we're through summer, so we don't have a lot of cases that have other comorbidities. So sure. Conditions that might affect your respiratory system and so on. And so this dramatic increase of cases is not matched by dramatic. I mean, there is still an increase in deaths, unfortunately, but it's not as dramatic as it was, for example, in the state of New York in April.
Yeah, right.
So the mortality rate is not so high. Mm-hmm. So that is good, of course, but it's not good the fact that the virus has been going around, it's been spreading so much because of these large numbers. But to go back to the original point, the lockdown hasn't worked because it wasn't implemented long enough. It wasn't done properly, and therefore it didn't drop the numbers like it did in other countries. Now, because of economic reasons, we can't go back into lockdown because the economy has already been affected dramatically. So the ball goes in the field of every individual citizen.
Yeah.
It can't be now a government decision unless, we go into even further emergency. but it's really a matter of individual responsibility within a crisis of community medicine.
Sure.
So every citizen must be responsible for himself and the others. And everybody must realize this is a matter of community medicine, of emergency that involves everybody. Unfortunately, people seem to be more responsive if they're affected in first person or indirectly with a member of their family. If they're not, especially, again, younger people, unfortunately, that, again, with all the respect for the younger generations, but they have that feeling of like being almost invincible or, less, less prone to be affected by the COVID infection.
Right.
And which biologically is true because, of course, they're healthier. They do not present comorbidities that might be more frequent in an individual that is 60 years old or older. But that doesn't mean that they cannot get COVID. That doesn't mean they cannot be an asymptomatic carrier and spread the virus.
Sure.
So to give you, a final answer to your question, I think that it's a matter of spreading the knowledge and the awareness that everybody must do his part. If we don't do each of us our part, it's not going to work.
Right.
And I'm really concerned for the cold season, that is ahead, because I don't think there will be a vaccine available at the beginning of the fall.
Right.
And if there is no vaccine at the beginning of the fall, I don't know how it's going to be now that the schools will reopen, now that, the rain will come and, other symptoms will occur again. And I don't know what we're going to face in 2 or 3 months.
Yeah, it's a lot to be found out. I'm thinking as you're talking about this, you mentioned the first time we spoke about COVID, about responsibility. And I appreciate that you did that, because the way that you eloquently stated that and respectfully to all people is this is a community effort. It's each person needs to take responsibility. And, I'll admit it, I'm bugged when I see somebody who rejects wearing a mask, and I think of things like, well, my daughter's pregnant, she's due in 3 months, and if you infect her and the baby is harmed, and I'll be really upset. Hopefully they'll be okay, but maybe you are an asymptomatic carrier and you don't want to, and it's your freedom of whatever. But then again, I posted something recently that I didn't get any flack for it. It was once in a while I post and I get some flack. I try to be nice though. Don't let your personal, personal rights get in the way of your responsibility to others.
Mm-hmm.
We are a community. Compassion would be a really nice thing for people to exercise, especially now. People are still cooped up in many places. They're not working. Maybe they don't have somebody to talk with as much because people aren't coming over to visit. They're not getting out, and depression is on the rise. Anxiety is on the rise. And boy, now's a great time to show compassion and be responsible.
Yes, and I understand this is a huge change. Nobody was prepared for this, and people perceive this as a failure of the health institution. But in reality, this is something that has been for a long time. People have warned in science about the fact that we were not really ready to face a pandemic from a new pathogen. And this has been the proof. And, when people complain that science didn't do enough, what science did generate models, predictive models that showed that, a combination of viruses, rearrangements of viral genome, could have generated a new pathogen like this. But this is not sci-fi. This is not
right.
out of the ordinary. This is something that has been predicted by models long ago.
Sure.
The problem is that nothing has been done to implement a proper system to face this. And it would have not been easy. Let's be honest, would have not been easy.
Mm-hmm.
But it was a possibility. And it was a possibility that was mentioned. Unfortunately, nothing was done before, and now we're facing the consequences. But I don't mean to get into politics. I mean, that's definitely not my field. But the problem is that the only answer now is up to us.
Mm-hmm.
And science is working in the form of pharmaceutical companies, academic institutes. There has been a huge movement about supporting research on COVID, and there are results that are already remarkable. They're already out there. But other than that, I mean, in the end, it's up to us. I think that we became, in this past decades, became too dependent on the one pill model. The problem, you take a pill, the problem is over.
Mm-hmm.
You have a headache, you take a pill. You have a stomach ache, you take a pill.
Mm-hmm.
And we lost the concept of life hygiene and how important it is to adjust our life to improve our health and other people's health.
That just made me think of something. And if there's anything you don't want to answer that I ask you, just say so. It's okay with me. But I have two things right off the bat. But first of all, I remember that back in maybe January, February, Italy was hit very hard before we were. You're from Italy. How are things in Italy right now? How is your family? How are things going, and are they okay?
Yes, thank you. Thank God they're okay. The situation in Italy is definitely better, more under control. They're having 150 to 100 new cases per day, but just like with the United States, not many cases requiring ICU. So
Okay.
Some of the mechanisms that we discussed for the United States do apply to Italy as well. People out of lockdown are becoming less observant of certain rules. It's that time people go to the beach, people go to some vacation areas, want to get together after months of lockdown, and they are, less strict about applying or following certain rules. But luckily, the numbers dropped low enough that it's easier to monitor and manage the situation. There are some factors there too, like human aggregation in certain touristic areas, or immigrants coming from Northern Africa that are coming with no control, no filters, therefore there are cases. So there is still a certain discrepancy between the North and the South. See, here in the United States, geographic distribution has switched. Before it was the Northeast area, and now it's more the southern states. In it stayed pretty much the same. The northern regions are still the ones that are more affected, with the exclusion of certain isolated areas that sometimes burst out in some regions, because maybe you have a boat full of immigrants coming to southern region. There are 20 new cases. Of course, they are recorded under that particular region. But the key difference is that the numbers did drop. So they went down. Like I think today they have no more than 40 or 42 cases overall in the whole country in ICU.
Wow. So I'm very sorry, I'm interrupting for 1 second, but didn't they also have more of a strict lockdown for a while in Italy than we ever had here? And do you
Yes,
think that helped? That must have helped.
absolutely, absolutely. It was very different. You needed a self-certification to leave your house. There was police on the street that was stopping everybody to check their self-certification. The rules were much stricter.
Okay.
Activities. It was not possible to gather under any circumstance, and even the allowance to grocery stores or other whatever type of stores stayed open was way more limited. You could see, long lines with people 6 feet away because only a certain number of people, was allowed.
Sure.
I mean, it was stricter. It was a way more robust effort from the government to monitor the situation.
Yeah, and it seems like that they had positive results there, that we haven't seen the same type of results. I think in China that was the case too, in various areas, complete lockdown. One
Yes.
person in an airport, probably a security person or whatever, but and it seems like their numbers are down too. I don't know for sure. You can correct me if I'm wrong though.
Yes. The situation in China, of course, is always. I mean, we have to start with the premise that either we trust their numbers or we don't.
Exactly. Yeah.
So
Sure.
if we trust their number, it's done. But even for more trustworthy sources, we can easily compare that. Like Sweden was an example of a country that didn't issue a lockdown at all. And if we compare the numbers in Sweden in terms of number of positive cases and number of deaths with the surrounding countries, because of course you have to consider, the environmental context, you have to consider the political context and
Right.
all the factors. Sweden has a mortality rate that is from 7 to 10 times higher than the surrounding countries like Norway, Finland, and Denmark. Denmark is 7 times, so it's closer, but just because Denmark is connected to the continent.
Sure.
Sweden, Finland, and Norway are more isolated because they're in the Scandinavian Peninsula.
Yeah.
So really that was a proof that not issuing a lockdown was a mistake.
Yeah.
And it's not a coincidence that countries in Europe that either started late or issued a softer lockdown, like United Kingdom or Spain or Sweden, they are the ones on top of the standings, if you want to call it like that, but on top of the list for number of cases and number of deaths. So that is something. And again, I'm not talking about politics. It's always difficult to take certain decisions. There are a lot of factors.
Sure. Yeah.
I'm just saying that by looking at the results after a decent amount of time now, we can start making some comparisons, and we can say that a hard lockdown paid off more in terms of dropping the numbers of cases.
You just said what I was thinking. I don't need to say it now. It just seems like lockdown is the answer to have better, more favorable results.
The problem, and again, I'm not talking about economics because I'm not an expert, but the problem, unfortunately, it doesn't seem to be a feasible option now, again, unless a very severe, even more severe crisis is in place, because the economy has already been hurt badly.
Yes.
If we go back into lockdown, probably a stricter one, the consequences will be even more deleterious.
Yeah.
The problem was that the lockdown must have been issued in a different, stricter way before, and probably being kept longer because it was lifted too early. The United States had already numbers that were higher than most of the other countries, and they didn't show a clear decreasing trend when the lockdown was lifted. It was lifted anyway, and again, I don't want to discuss the parameters because they're way above my head, but once you lift it, even with all the recommendations, it's a recommendation. It's not a law.
Right.
Like in Italy, if you were stopped and you were not wearing a mask or you didn't have your self-certification, you were receiving a fee that was quite expensive.
Sure.
in the United States, I know that some states now have issued something similar, but now we're talking again 6 months
Yeah,
into this problem.
it's pretty far into it now. Well, the other thing of the two things I was thinking, the other thing is, and this might be the one, I don't know if you want to answer it, but I will ask. You're close to Georgia. My son happens to work in an ER at Emory in Atlanta. And that aside, that actually has nothing to do with it other than he's seeing a lot of COVID lately, especially since Georgia reopened quickly. But my actual thought here that I'm concerned about or thinking about is school has started there, to my understanding, yesterday, I think. No masks are required from what I understand. How do you feel about that? What do you predict anything happening in Georgia? I mean, I can't help thinking there would be, not to answer the question I just asked you, I just can't help thinking there'd be a surge, a spike in cases, ERs get filled up, schools close again. What are your thoughts on this?
Yeah, it's a situation once again because schools have to reopen, and the reason for that is that the online system didn't work to the extension that was expected.
Sure.
Only in the state of South Carolina, over 10,000 students between elementary, middle, and high school went ghost. So they didn't connect through the lockdown, and they passed the year by default, basically, but they didn't do what they were supposed to do. That cannot be allowed, of course.
Yeah.
So schools have to reopen. Are schools prepared or ready to manage social distancing? No. You can't have a classroom of 20 people and 20 kids and put them 6 feet away from each other.
Yeah.
So there have been considered several options, like alternative days, part online and part in person. And I'm sure that there will be some adjustments through the year. But the problem is that we need to learn to coexist with the virus.
Yeah.
Because the premise is that if you're not on lockdown and parents are going back to work, what's going to happen to the kids? They're like real life questions that, of course, can't rely on epidemiological studies on how the virus is doing in Japan or in Sweden. So you got to think about your everyday life. And so the answer, once again, is that everybody must be responsible. So
exactly. Yeah.
Not required, never mind, you're going to wear them anyway.
Yeah. Well, it would seem
distancing,
like it.
No,
Yeah.
Social distancing cannot be granted. Never mind, you still don't touch your classmates.
Yeah.
Yeah.
Well, it's going to be an interesting few months ahead, and more than that. But I'm, looking at the next. Let's see. We start. Public school starts here in 1 month. It's usually the Wednesday after Labor Day, typically in New York State. Some places start Tuesday, but it's early September. College where I was working, which I really don't want to have to go back there, and my responsibility, being responsible for me, would be to stay away. Otherwise, I'm going to hate my job, and that's not a service to anybody. I don't want to hate going. Hate's the strong word. I don't want to dread going into work because of all the protocol to follow and all that. But so that would be me being responsible. But for the others who are going there, it just seems like with colleges, public schools starting up, it's going to be an interesting fall season coming up for us, and I hope it doesn't get too out of hand. I guess maybe you and I might have to talk in like November or October.
Yeah, let's hope with good news. I mean,
yeah, hopefully so. Yeah,
I don't want to sound like someone that is trying to spread pessimism. I want to spread awareness, which is different.
No, and that's one of the things I love about talking with you is you approach from, and I'm interrupting, I'm sorry, but I just want to say I appreciate you being realistic about things. And we have similar missions, and mine with the education I do for Parkinson's. It's just about awareness, education, and being mindful of what are the best things we can do to protect ourselves and others.
It's like you're walking in the jungle, with a group of people, and you hear a roar on your right, say, my gosh, there could be a lion or a tiger, and the response people instead like moving away from the light, oh, you're just being pessimistic. I mean, I'm not being pessimistic. I'm trying to raise awareness,
Yes. That's
the
a
goal
great
is not to
analogy
be,
too.
the goal is not to be eaten by the lion. The goal is to prevent that.
Yeah.
But to prevent that, if I feel that there is a risk of being attacked, I need to share that awareness. I need to share that feeling.
Yeah.
Maybe we should, take countermeasures. So everybody grab the rifle, move away from the bushes on the right, try to, instead of saying, no, you're being pessimistic, it's going to be fine. I got to say, I don't like to talk bad about, my own country, or it's not the whole country, but some people. But when this started in Italy, people were using an hashtag that translated is like, everything is going to be fine. I didn't like that. I got to be honest. And I say that, full-hearted, because I love, of course, my country fellow Italians,
I love Italy too, and I love the people.
and I like, giving a positive message.
Sure.
But the unjustified optimism that was implied, and that everything is going to be fine, I don't think it was supported by reality. How can you say everything is going to be fine to a kid that just lost his grandfather? Because that's something you cannot reverse. So it's not fine. A member of your family is gone forever.
Yeah.
So that's really not fine. It's a status that you cannot change. So everything is going to be fine if you have one semester in your commercial activity and you are, below the parity, below zero. You're losing some money for that semester. But say, okay, it's going to be fine. We have some savings. We're going to bounce back. You can use that. Nobody,
Yeah.
But when people are dying, you can't say everything is going to be fine. So that's the kind of sentiment that I have. Talking about the risks, talking about the consequences, talking about the negative trends, it's not because I or other scientists enjoy things going bad. It's because we want to prevent things from going bad or going evil.
Mm-hmm.
And I think that sort of awareness is the key. We need to educate people about the risk and about what is so far, the countermeasure that can work.
Mm-hmm.
We will have countermeasures even more effective, but we have to work with what we have.
Yeah, so your lion in the bushes analogy is actually perfect. I love that because it just couldn't be, I don't think it could be analyzed any better or compared any better. Now, I know you shouldn't talk politics. This is not, but I can. This is my show. So you can just sit there and not say a word. Don't shake your head. Don't agree, because you shouldn't. But we have a certain president here in this country. Everything's going to be fine. We've done all we can do. Really? Well, I don't know. I don't know if we can. I suspect we probably haven't. And again, you don't see anything, but when I look at it, there are other leaders too, though, who are have done a lot, really taken a proactive stance, and the states have done fairly well. And then there are the other ones who everything's going to be fine, and now the people are in hospitals after reopening. So, yeah.
I would take that, with the medical standpoint.
Sure.
Again, I don't want to talk politics, but the specialists in the medical field have provided an almost uniform series of guidelines. They were almost all aligned. There were people that were, going in different directions.
Sure.
I don't know if it was for political interest, economical interest. I don't know. I don't want to know. But the evidence-based guidelines, that's the key.
Yeah. Thank you.
Evidence-based guidelines were all going in a certain direction. Now, that's the job that is required from scientists, to look at the facts, discover, investigate, analyze, and come out with solutions. Then it comes to the politicians to apply those solutions or not. You can embrace them or you can reject them. That's politics. That's not medicine. That's not science. So I can speak for the scientific part of the story, and I can tell the guidelines were pretty clear. And they were all going in one direction. There were some adjustments, like at some point the World Health Organization said, you don't need 2 negative swabs, 2 negative tests to go back to work, as long as you don't have any symptoms, because that was hampering, the amount of people back to work, because the tests were not turning negative after a long time. So say, if you don't have symptoms, if you, observe, the rules, wearing masks, avoiding contact and all that, you can go back to work. That was an adjustment from what they originally stated. But again, it was an evidence-based adjustment. The fact that people could stay positive at the swab test even after the symptoms were gone away.
Yeah.
But I stop there and say guidelines were proposed locally at the level of the United States and internationally. Some politicians decided to embrace, to accept, to apply those guidelines. Some politicians decided to leave the World Health Organization. So,
yeah, Well, I understand what you're saying. And actually, the way you said that is beautiful. It's very, very simple, actually. I mean, the evidence-based guidelines are pretty much, they are what they are. They're pretty much uniform straight across the board. People are going to choose to conform to them or ignore them. And both are happening, unfortunately.
Yeah.
Yeah, politicizing things is seems to be happening, but again, I don't want to get into politics too.
But I just want to say this about that is political, and I apologize if anybody gets offended. I'm just, there's a personal opinion, so you may agree or disagree. If you step away from the community table, everybody loses. The reason why there are worldwide organizations like the United Nations, the World Health Organizations, and so on, is to generate common strategies for common problems.
Sure.
If you disagree, make it clear. But if you step away, everybody loses.
I'm really glad you said that, because I think on some level, I feel like I knew that, but you just put it in a way where it really makes a lot of sense. The WHO, these organizations worldwide, that is what they're doing. And they've been doing it for years and years and years. And so I don't know enough to say anything other than that. I don't know how we could ignore those, but I know some people want to ignore them or, not associate with certain ones, which makes no sense to me. It seems like we should be learning together.
Let me say this. The system is not perfect.
Mm-hmm.
I'm not saying that WHO is always right. I'm not saying that there are no economical interests, behind certain decisions.
Sure.
But if you want to change it, you can only change it from the inside.
Yeah.
If you step away, then it's already a failure.
Yeah. You're always so generous with your time and your knowledge. This is just, to me, I learned a lot talking with you. I always do, but these past few minutes really shed a new light on how I see things, which I really appreciate.
Thank you.
So if we were to sum everything up, we could say that we're in for a lot of unknown right now. Can speculate probably some type of spike. Wearing a mask, hygiene's very important. Wash the hands, be respectful, be part of the community, and take responsibility for others, right, and yourself. Do you see if that's the best strategy? It certainly makes sense to me. Do you see anything additional measures that might need to be taken? And then this is a two-part question. Might there be mutations of this at some point where COVID, something else, brothers and sisters of COVID-19 show up, and then, who knows, right? They could be worse or they could be better. I don't know. But any thoughts on that?
Well,
not to be pessimistic, but it's a reality,
no,
right? It could happen.
It's already mutating. So there are, subtypes already. And it's logical, with such a vast distribution, imagine, all the basin of, individuals that can share the virus, and the virus can recombinate and change. It's hard to tell what's going to happen. I hope that the vaccine will come before a new strain will rise. Mm-hmm. And the vaccine will have to adjust. Again, it's always a matter of cause and effect, action and counteraction. I think that we are now learning to live in a different world where there is more attention for the personal and the community health. And in some way, it's, I know it might be a provocative comparison, but in some way, this is what AIDS did to promiscuous sex, in the 80s. Mm-hmm, mm-hmm. It was right. Something that was dramatic impact.
Sure.
But really changed the concept of sexual interaction, and not because there were no sexually transmitted disease before, the HIV virus, but definitely it raised the level of awareness, and it implemented a series of precautions that nowadays have become part of our normal life.
What's interesting is my wife, we lived in Chicago when AIDS was first a thing. We were newly married. She's an RN. She was working at a Rush St. Luke's Presbyterian Hospital on North Lake Shore, north side of Chicago, far north near Evanston. And because she was the only nurse with no children, she was the one elected to basically get in a kind of like a space suit, like an astronaut would wear, and go into a place where the person with HIV had a bubble, because they didn't know if it was an airborne also type of thing. And wow, look at the changes even a couple years after that, and then now what we know about it. So we remember that very well because there was such a panic about that, rightly so, of course. But it's funny, I hadn't gone back recently. I have thought about it during this pandemic, but not in a couple of months. But yeah, that was a big learning curve for many years. Probably still is to some degree, but I guess we're in for that with COVID too, probably, huh?
I mean,
learning.
I know we're talking about two different levels, but think about, if people were refusing to wear a condom back then because they say, oh no, this is limiting my freedom. I have the right to decide what I want. And, if I give you AIDS, it's not my problem. Or if I catch AIDS, it's not my problem. So that would have sounded insane, right?
Yeah.
And, or, maybe some people that were extremely selfish or, they didn't realize that the risk, they were saying such things. Nowadays, we're talking about something that is not, as impactful, in everyday life. It's just wearing a mask, but people are still complaining about that.
Mm-hmm. Mm-hmm.
And I think that I'm not saying that eventually, in 100 years, we're going to walk around like your wife was in that unit, like sort of protect ourselves from everything. Hopefully not. But we need to be aware that risks are out there. Like I said, there were STDs before AIDS. There was a series of airborne pathogens before the COVID-19. These things happen.
Right.
So we need to be more aware that we have responsibility as citizens. I like to talk about the concept of citizens because we're part of a community. If you don't agree with certain rules, you can't just ignore them because you're provided with services as a member of a community. You can't ignore that. We talked the other time, about you can't say, oh, pull off a soldier from the army because I don't want to be protected. It doesn't make sense. Or don't put asphalt on this part of the road, the highway, because I don't want to pay for that. You can't do that. There are some, immutable things that they're inevitable. Like you're part of a community, you receive certain services.
Mm-hmm.
But you're also called to respect certain rules.
Mm-hmm.
So you can't have one without the other.
Right.
So I'm saying citizens, and not individuals, because individuals tend to highlight the isolated person, single,
mm-hmm.
by his own. And citizen means you're part of a community. And you have to be aware of what is your place in that community.
Right. Yeah, I'll tell you, it's really interesting. I really appreciate your time here. I didn't say this in the beginning, but I'll ask you now if you don't mind. Do you have any? You pretty much, I think, just told us everything that could possibly be known at this point. But is there anything additional before we finish that you want to say? Any words of wisdom, if you could sum it up in one short statement?
Yes, and I appreciate the opportunity. This is something I always tell, families of patients when it comes to genetic disorders or any sort of medical condition. You have all the right to go and inform yourself and educate yourself. Search the internet, talk with friends or family, read papers. The key is that you got to check the sources. That's crucial. When it comes to this level of information, for people that do not have the background, you can't take a degree in medicine and then open, turn on your internet and go and search. So if you don't have the background to filter that information, check the sources.
Mm-hmm.
Peer-reviewed paper, professionals, like nationwide or international institutions, something that they can't afford to spread, news that have not been validated and checked. So do that and try to set aside the idea that everything is a conspiracy, that, there are financial interest in selling the masks or developing the vaccine. I mean, we're all on the same boat here.
Yeah, I hadn't even thought about that. I'm sure there are those who are, though.
Well, there are people that believe that, there is this is all a hoax that was generated to sell the vaccine or something like that. So it's just check the sources. That's the key. Go out there, inform yourself, educate yourself, find answers to your questions, but look where that answer is coming from.
Perfect. Well, you've certainly been have been and are a great source of information. I really learned a lot today, Luigi. Thank you.
Thank you.
Well, if you don't mind, after I end this, if you don't mind, just hang on with me for a minute.
Yeah,
but
sure.
I'll close out here. Yeah, that was very informative. I feel like kind of have a little bit different perspective of things now. It's kind of like, I call it the 40,000 foot view. Sometimes I get down too close and I only see certain things, but if I back it out, like I'm in a plane and I can look at the earth from above, I always see different things and I think different in the sky, in the air, but this gave me a different perspective, which I appreciate. So thank you. And I hope you enjoyed this too. A lot of great information. I think that the thing that I really, really implore people to do is think about the people who are important to you. So many examples given in the past hour. Think about the people who are important to you and a responsibility. What responsibility or what can you do as a responsible person to protect those people and other people too? Okay, everybody and yourself. Wear your mask and wash your hands. Just do it. Do what you're told to do. So,
yes.
Thank you, Luigi. I appreciate that very much.
Thank you.
All right, my friend. And, we'll talk down the road again. We'll talk about something. But maybe this again, too, after we learn more. Thank you very much, my friend. Thanks, everybody, for watching. Have a fantastic day. See you again soon.